Cutting down or drinking less can lead to many benefits, and some of those can be immediate. So things like your better quality sleep and better mood and improved energy and clearer thinking. And then also those longer term factors as well in terms of reducing that risk of cognitive decline over time, but also of other health and social care problems.
Hello and welcome to the HSE Talking Health and Wellbeing podcast. I'm Noreen Turley, and today we're talking about alcohol in the brain. Is there a difference between drinking a little and drinking heavily when it comes to brain health? I'm delighted today to be joined by Dr. Sean O'Dowd, Consultant Neurologist and Clinical Lead for HSE National Dementia Services, and Dr. Claire Neill, Consultant in Public Health Medicine with the National Health Improvement Team. So Sean and Claire, thank you very much for both joining me today.
Thank you, Noreen.
Thank you, Noreen.
Okay, so I may give you an opportunity to introduce both of yourselves because both of you have been on the podcast a number of times, and I just wondered, do our audience really know who you are and what you do in those complex jobs that you do have? So I thought, Claire, will we go to you first, and as a public health doctor, what does that actually mean in practice so that the public understand what a public health doctor does?
Thanks, Noreen. No problem at all. So ultimately, public health is really about preventing disease, prolonging life and promoting health and well-being. And that includes through organised efforts of society as well. So I suppose differently to many clinical roles, instead of focusing on one person at a time, our focus tends to be on populations or groups of people, and communities or entire societies. And we're often focused on keeping people well in the first place, so not just the focus on treating illness after it develops. And a big part of that as well is reducing health inequalities and making sure that people have access to the building blocks of good health. And it can often mean stepping back and having a look at the bigger picture. And as you can imagine, it involves working across many sectors as well as healthcare, because obviously our health is shaped long before we ever step into a hospital or a GP surgery. And that can involve considering the factors that shape our health and what patterns we see across different groups and who might be most at risk and what interventions or approaches would have the biggest impact for those groups as well. But ultimately, yes, it's about prevention, reducing harm, tackling inequalities and also improving health at a societal level.
Okay, so you'd be looking at all the research around how we're living at the moment and how best we go forward with health into the future as well, and advising people who are developing the services, I guess.
Absolutely.
Yeah. And Sean, you're the national lead for the dementia services, but you're also a neurologist. So that's a pretty busy day as well, I'm sure. So do you want to give us a little bit of background and how you came to that or what you do on a day-to-day basis as well and the type of people you see?
Yeah, so I'm a consultant neurologist, and neurology is the branch of medicine that deals with disorders or diseases of the brain and nervous system. So that includes a wide range of conditions, anything from dementia to stroke, epilepsy, multiple sclerosis, migraine, or conditions that can affect what we call the peripheral nervous system, so problems with nerve and muscle function. So my own particular specialist area within neurology is neurodegenerative diseases, so cognitive disorders, dementia. I became interested in that as I was coming through my training as an area that sparked particular interest because it's an area that we're really just getting to grips with now in terms of understanding the things that underlie the causes of those diseases and hopefully moving towards better treatments for them. So day to day, in terms of the clinical job, mostly I concentrate on the neurodegenerative diseases, but I still see people who present with other difficulties. And certainly from an alcohol perspective, it's something that we see impact very significantly on neurological health every day, be that in terms of its impact on things like epilepsy control or the function of nerve or muscle. And of course, the fact that it's associated with increased risk of dementia.
Yeah, I think we'll have a good podcast and we've a lot to talk about. So when we're talking about alcohol, I'm assuming that people think about kind of the liver and the heart, but do they actually really think about the brain? And today we really want to tell people and explain to people that the brain can really be affected as well, can't it, Sean?
Yeah, absolutely. It's kind of useful maybe to think of the effect of alcohol on the brain in the short term or kind of acute processes that happen when people are drinking. And then the kind of the longer term or chronic effects that alcohol can have, particularly when it's consumed at harmful levels over a long period of time. In the acute setting, so when somebody is consuming alcohol, what we know is happening is that alcohol is a small molecule. So it's absorbed very easily from the tummy, from the gut, and then crosses the blood-brain barrier. So our brain has a pretty good protective mechanism to try to prevent toxins from getting in there. But alcohol is small and very kind of soluble, so it can get around that. So it gets in quite readily into our brain where it begins to take effect. And particularly it seems to like the frontal part of the brain, which is the part involved in judgment, decision making, speed at which our brain works and processes information, and also the memory center, which is the hippocampus. And it has a kind of complex effects on the brain, really. But I suppose broadly speaking, it has this effect on the chemical balance in certain neurotransmitters in our brain. So there's a neurotransmitter called GABA, GABA, which is involved in switching off neuron function to a certain extent and relaxing transmission between nerve cells. And for the person, that culminates in a feeling of sort of relaxation and sedation and so on. And then in compensation for that, it turns down a neurotransmitter called glutamate, which perks up the brain and is involved in what's called excitatory transmission. It kind of alters that balance. There are other effects then as consumption increases. Alcohol is metabolized by the liver, and the liver is also responsible for generating sugar levels and so on. So with a heavy bout of alcohol consumption, the blood glucose level can drop. And then another important aspect on brain function is its impact on a hormone called vasopressin, which is responsible for maintaining our fluid or water and electrolyte balance. So alcohol directly stops vasopressin from working. And that's what makes people need to go to the loo more and when they're drinking, and therefore can culminate in dehydration and electrolyte imbalances in terms of salts and minerals and so on in our body. So the effects in the acute short term are quite complex, really. And in sort of a longer term use, then we know that alcohol consumption at unsafe levels over time can have a lot of effects on the brain and nervous system, not least the volume of the brain. So the amount of brain tissue we have there, particularly the grey and white matter, which are responsible for our thinking and our memory function, as well as the balance center of the brain at the back of the brain called the cerebellum, is particularly vulnerable to alcohol effects, both in the short term, but also in the longer term. And that's also the part of the brain that's associated with speech clarity, which is why we see people slur when they've had a lot to drink, or with heavy consumption over time, that can become a fixed issue. And the peripheral nerves, so the nerves which serve sensation and power to our hands and feet, they're also very vulnerable to heavy alcohol use. And that can manifest then as a thing we call peripheral neuropathy, which can be often where alcohol is associated with quite a painful type of syndrome with burning and uncomfortable tingling in the feet and hands. And also that can be over time associated then with power problems, so fine motor movement and further balance difficulties. So they're the chronic issues. And of course, we know from a lot of studies, and I think we'll talk about that in a bit more detail, that alcohol consumption is also very definite modifiable risk factor for the development of dementia.
Yeah, there's a lot in that now, really, isn't it? The other thing is, I know that we've discussed this before in a podcast, Sean, the importance of young people not starting to drink or trying to encourage young people because their brains are just being developed. That's something we should probably mention too on this.
Yeah, I think that's a really key point, as Sean has pointed out so well, how broad ranging the effect on alcohol is on the developing brain. Thinking about younger people, that certainly can have a risk over time, partially because adolescence is such a critical period for brain development, and alcohol can interfere with those normal processes. And I suppose just thinking about what that looks like in practice in terms of alcohol use in young people, our Healthy Ireland survey in 2025 found that hazardous or binge drinking is actually highest among 15 to 24-year-olds of all of the age groups. And actually use amongst that age group of alcohol has been seen to increase as well. So it certainly is something that we would be concerned about from a public health perspective. It's important just to really reflect the context around that. I mean, alcohol use in young people doesn't really happen in isolation. It is strongly shaped by our social context. And we've a lot of research in the Irish context that shows factors like parental monitoring, higher parental tolerance of drinking, or peer alcohol or substance use all increase the likelihood of alcohol use in young people as well. And then I suppose there are other risk behaviours that are important there as well. So we do see from the evidence as well that alcohol use can cluster with other risk behaviours. And again, data from the Irish context shows links with things like smoking and e-cigarette or vaping use and cannabis use. So it's really more of that wider pattern of risk-taking behaviour that really brings it into focus in terms of being a public health concern as well.
Yeah, and it is a constant battle to get that message out, really, isn't it? Sean explained it really well of what's happening to the brain when we do drink alcohol. Is the impact on the brain different if somebody is drinking, say they're drinking every day and they're just drinking a little bit, or they go out and they have one big night every week or every second week? What's the impact on the brain when it comes to things like that?
Well, I would say, Noreen, certainly where health is concerned, both are important in terms of alcohol consumption. As Sean pointed out, that sort of heavy episodic or binge drinking can certainly increase the risk of alcohol-related harms in the acute period. And that can be the impact that it has on the brain, but as well as that and the effects that it has on the brain, that can lead to things like injuries and accidents. And as Sean mentioned as well, things like impaired judgment and more acute events as a result of that. And for that reason, we see spikes in emergency department presentations associated with alcohol. And that happens, in particular at weekends, for example. It's certainly backed up by that evidence. But I would say at the same time, regular drinking and alcohol exposure over time is certainly a risk to both brain and broader health as well. And that's associated with a risk of cumulative damage and certainly of more chronic conditions over time. The World Health Organization made a statement just in 2023 based on the most up-to-date global evidence, advising that there really is no safe level of alcohol consumption where health is concerned. So ultimately, alcohol is harmful for health, and this increases with the amount you drink and over time. And certainly that risk will be lower the less you drink. But just obviously to reflect in that statement, low risk isn't necessarily no risk whenever it comes to health.
Yeah, and I've just seen that you've launched a campaign there around alcohol and pregnancy, Claire. So that's another important message to get out, that no amount of alcohol is safe during pregnancy. And as Sean said, the molecules are so small, they just get through the barriers.
Absolutely. And it's really important to reflect that in pregnancy, that alcohol use is not safe in pregnancy. And, because of the risk to the developing fetus and also to the pregnancy itself, there is that recommendation for no alcohol.
Sean, this is just a question I was thinking about there. I know everybody is different, but how can it be that some people have drank their whole lives and they drink a few drinks every night and they've no sign of dementia, or they've no sign of brain difficulties after the alcohol, but then there's other people who just can't get away with it?
Yeah, that's a really good question.
If you could answer that completely.
I'd be getting the Nobel Prize for Science, probably.
You would.
Yeah. No, but I suppose, not to be facetious, it is a complex question. Our understanding of that is evolving slowly over time. It is probably largely to do with, at an individual level, sort of individual, like what we call pharmacogenetics, in terms of how our genes and our individual constitutions predisposed or vulnerable to the effects of alcohol. We think of things as maybe nature and nurture. So there's a certain element which is sort of wired into us in terms of our susceptibility to alcohol and its harmful effects on the brain. And then by nurture, I suppose we were talking about other things, other factors that can increase those risks. So if you look at dementia, alcohol consumption is a clear-cut risk factor for the development of dementia. We know there are in total probably 14, in fact, that have been identified fairly robustly by very, very rigorous evidence factors associated with dementia, that if a person has several of those traveling along with heavy alcohol use, that puts them at a greater risk again, like smoking, like obesity, like uncontrolled blood pressure or uncontrolled high cholesterol. The thing with alcohol, and it's interesting that a lot of these risk factors are closely interrelated. So people who drink heavily often will also have problems with poor blood pressure control, will often also be overweight, will also often have depression, which is an independent risk factor for dementia, and are at a higher risk probably certainly for things like traumatic brain injury because of alcohol impacts on judgment and balance and so on. Again, traumatic brain injury of itself being a risk factor for alcohol. So it's probably a little bit like Claire was touching on earlier. It's sort of an accumulation of risk at an individual level.
Yeah, no, that makes sense. And then Claire, after then somebody has been drinking a lot and we have that hangover day, and people tend to make little of it and, I've got a really bad hangover, and it's kind of just par for the course, if you like. But what's really happening to us in the day after? Because that mood of, people say the horrors, or they just feel awful, they get depressed, they can't sleep. Like, what is really happening to us?
Well, certainly, I suppose the fact that you mentioned, Noreen, alcohol can initially make you feel more relaxed or sociable or confident. And actually, some research that we recently conducted in the HSE showed that more than 1 in 4 people use alcohol most of the time to feel more confident and for that effect. But that certainly is temporary and short-lived. And essentially alcohol is a depressant drug. So whenever it does wear off, you do tend to get that rebound effect that can lead to feelings of restlessness and poor sleep. And as you mentioned, that sort of next day low or anxiety. And we know that those problems can get worse over time as well. And we do see clear patterns of that at a population level of alcohol use being strongly associated with mental health disorders. And it is recognised by the World Health Organization as a significant risk factor in terms of mental health and suicide. And certainly within the Irish context, that is reflected in terms of seeing alcohol involved in 1 in 3 presentations of self-harm. So it certainly is known to be a depressant drug, and that is something that we see overall on a population level.
Yeah, so when we say the losers the day before, the people have a low day after they've been drinking quite a lot, obviously then it has a significant effect on their mental health. It's terrible, really. And what about the whole sleep thing then as well? People say, oh, I just had a couple of drinks, it helps me sleep. But does it really?
Yeah, the sleep is certainly an interesting one because we know that people can use alcohol to help them fall over to sleep. And to that person, it might seem effective in terms of helping them drift off more quickly. But certainly, yes, the quality of that sleep would be much more poor. And that's because alcohol disrupts normal sleep cycles, and that can lead to more fragmented sleep, earlier awakening. So, it's certainly not a restorative sleep. And again, that can lead to more problematic issues over time. So both in terms of problematic sleep problems and then that increased risk perhaps of anxiety and low mood as well. And people might feel that, after a night of drinking alcohol, that they wake up feeling more tired, irritable or anxious. And really that is just because it hasn't been a proper or restorative sleep.
Yeah. And just to our listeners, if somebody does make changes to their drinking habits, can the brain reverse it, Sean? Or we've done the damage, that's it? Just like when people smoke, sometimes that really awful damage is done and sometimes there's not a lot that you can reverse.
Yeah, the brain is what we say quite a plastic organ. So there is quite a capacity within the brain for recovery from injury or from, a kind of a sustained toxic insult, if you like, which heavy alcohol would tally with. And, there are certainly, as you said, I think the earlier in life that the harmful drinking patterns are tackled and reversed, the more positive the outcome. So certainly in younger people, if harmful drinking can be ceased, we know from some studies that things like there are studies which show that early effects on reducing volume of the brain or the kind of connectivity between the nerve cells and the neurons in the brain, that is reversible. As you touched on there, with sustained, very heavy chronic alcohol consumption, there can be some irreversible features, unfortunately, particularly in terms of the effects alcohol can have on the balance center, the cerebellum, but also in terms of there's a sort of a relatively rare but a very devastating type of syndrome that can be associated with heavy alcohol called Wernicke-Korsakoff syndrome, which is sort of an acute confusional state which can then become fixed as a form of dementia effectively, where people have immense difficulties with forming new memories. It's a really devastating condition and that is irreversible. But for the most part, for people who are out there and are drinking more than they should, if they reduce to the levels that are considered to be safer or cease altogether ideally, then a lot of the potential harm is reversible.
Okay, well, that's good. So if people are listening and they do want to make changes, that there are ways to do that.
Absolutely.
And Claire, it is about individual choice. But if we talk about the wider environment, Claire, and the business that you're in public health, what kind of measures make the biggest difference to alcohol use in Ireland? If we just speak from the Irish context, I'm sure it's similar. We have an awful set on ourselves, I think, for our alcohol consumption and the way that we're portrayed in the media and all of that. And we play up to that. What kind of measures need to be made or can be made?
We do have really good evidence on what works. And I suppose a key point in that is the importance of population level measures. And you touched on this there, Noreen, in terms of alcohol is shaped by very powerful social and environmental factors, things like marketing, the fact that it's so available, so accessible to people. And it's also considered so normal in our society as well. And that in the context of an addictive, widely accepted substance, those influences are really important. So alongside raising awareness, providing support, it is really essential to address those wider environmental drivers. And the World Health Organization actually highlights a set of priority actions for reducing alcohol use based on what is most effective. And again, on that population-wide approach. The first of those is really looking at pricing policies, for example. So things like minimum unit pricing and taxation. And these are amongst some of the most powerful tools, because we know when alcohol becomes less cheap, we do see reductions in certainly binge drinking and more heavy use. And that's particularly among higher risk groups. And then also reducing availability. So things like limiting the hours of sales of alcohol or the density of alcohol sales outlets. And again, that's really to address how available alcohol is, because the more it is available, the more people drink, and then the more harm we see as a result. And then thirdly, restricting marketing and sponsorship. And we obviously touched on this as being an important factor in terms of that normalization of alcohol. And that's particularly the case where young people are exposed, and advertising can shape what feels normal to us. And it can certainly drive earlier use and heavier patterns of use as well. So it's another really important one. There are other important measures that can reduce harm directly to an individual, and it can also shape norms around alcohol. So things like drink driving enforcement, and then on a more individual basis as well, having the availability of alcohol screening, brief interventions and support available within healthcare settings. And that's really just, ensuring that we're able to support people to cut back early, as Sean alluded, from a brain health perspective, how important that can be. So that's something that's really effective. And importantly, Ireland has implemented many of these through the Public Health Alcohol Act, and also healthcare interventions and work of the HSE and others. And importantly, I suppose as well, these measures are well aligned with what works and in terms of international best practice.
Yeah, and Claire, there's a slight delay with the whole warning labels on alcohol to warn people about liver disease and not drinking during pregnancy. Where are we at with that?
Yeah, so you've rightly mentioned, Noreen, that there is a slight delay with that, but that is part of the measures included in the Public Health Alcohol Act and will come into force. And that's really important for people to be able to make informed decisions regarding their alcohol use, that, again, we're really getting that awareness out there around the harms associated with alcohol, and also addressing that normalisation in society as well.
Yeah. And I know this is another difficult one. It's in the ether at the moment, shall we say? But we have the whole thing about nightclubs opening all night or until 4 o'clock. And I know that's difficult when we have all the evidence, and for public health and for all the people who are kind of trying to prevent that is another difficult one. And we can see huge issues with that, really, can't we?
Absolutely. Availability is so relevant in terms of people drinking alcohol. And, we know that the more available alcohol is, the more people drink, and then we see more harm as a result.
I guess that's a lot of the job that public health are doing, is trying to inform the policymakers, trying to inform the government of the risks involved in these things and work with them to try and get the best for the public, really. It's hard to get that message across then about alcohol without being paternalistic and patronising. And so the language that we use is kind of difficult, isn't it?
Yeah, no, absolutely. I mean, certainly how we talk about alcohol is so important. Things like stigma are a real barrier, and that can stop people speaking openly about alcohol or seeking help. So in that respect, how we talk about alcohol really matters. And it helps really to start from that understanding that alcohol use isn't just about individual choice, and it is shaped by wider structural factors, social factors. And these can also create health inequalities, because some people are more exposed to risk and have fewer supports available because of those factors as well. So we really do need that sort of whole population approach and a focus on equity, and making sure that we're creating more supportive environments where healthy choices are easier for everyone, and also alcohol is less normalised, and that we're able to provide support where it's needed most.
Yeah, I suppose that's what we're doing in the health service now, is trying to bring those resources closer to the person at the right time, in the right place, and to prevent that stigma that there is in local communities around consumption of alcohol. And if somebody does have a difficulty, I think if anybody else has any other addiction or illness, they can be so much more open about it. But with alcohol, it is very difficult for people, isn't it, really? So, Sean, before we finish, I'm sure you have a lot of things to talk to people around brain health. But in relation to alcohol, what are the key messages that you think somebody listening today that they can start doing, or you advise them to do, that will help prevent damage with alcohol and their brain?
Yeah, so I suppose we know that alcohol consumption, particularly if it's sort of sustained at moderate to high levels over time, is an independent risk factor for dementia of all types. Dementia, of course, is not a diagnosis in itself, but describes a situation where people have developed cognitive problems that interfere with day-to-day function. And the most common cause of that is Alzheimer's disease, but there are a multitude of other causes like vascular dementia, Lewy body dementia, frontal temporal dementia, and so on. And alcohol seems to be a root cause or a contributor to all causes of dementia. Probably because not only does it cause direct harm to the nerve cells and causes them to shrink, but also alcohol and how our brain and our body has to handle alcohol kind of incites local inflammation near nerve cells and so on. And that's certainly from a mechanism point of view seems to be associated with the buildup of these toxic proteins that cause the likes of Alzheimer's disease. So I think people are very aware. We know from some of the work we've done in National Dementia Services around brain health, they're very aware of the burden, so to speak, that dementia can bring at an individual level or at a social level. But it is difficult to bring that back then to looking at your own personal decisions and lifestyle, to use that phrase cautiously. But there are lots of things, particularly in middle life, that are associated with higher risk. And alcohol is one of those, along with other behaviors that can sometimes be associated with alcohol use. So they're not taking adequate amounts of exercise, smoking, and high blood pressures. And these are all things that are very easily treated from a medical perspective. From the alcohol point of view, I suppose, like Claire has said, it's not as though there's any evidence to suggest that any amount is safe, but we know that harm can certainly be reduced by observing the guidance that's giving on reducing potential harm from alcohol. And I know that Claire and yourself will probably direct people towards the HSE
Yeah.
and the public health websites, which are really useful for that at an individualized personal level. So there's a very broad concept that if you drink less, you gain more. And that's true. You gain more in your pocket for one thing, but you also gain in terms of better quality sleep, better quality mental health, better quality physical health, having more energy to get out and engage in social activities, engage in exercise, all of which are really protective for our brain.
Yeah, a lot of younger people aren't drinking anymore and they really are looking for alternatives. And we have all these running groups and I have family members who have given up alcohol, and the difference that it's made to their lives is incredible, really. And when you hear people talking about it, it's fantastic. And they definitely have gained more, I think, Sean. And I'm sure that's a message that you'd be giving, Claire, from a public health point of view. Drink less, gain more. It's a great catchphrase.
Absolutely. No, as you rightly said, cutting down or drinking less can lead to many benefits, and some of those can be immediate. So things like your better quality sleep and better mood and improved energy and clearer thinking. And then also those longer term factors as well in terms of reducing that risk of cognitive decline over time, but also of other health and social care problems as well. So it's a really key message.
Yeah. So thank you very much to Dr. Shauna Dowd and Dr. Claire Neill for joining us today. If you're worried about your drinking, you can call the HSE Drugs and Alcohol Helpline on 1-800-459-459 or visit Ask About Alcohol to find out clear information and support. Your GP is always the one you can go to that will listen, advise and do a brief assessment for you and refer you to HSE Drugs and Alcohol Service or counselling if you need it. The other thing is that to remind people that this is a free phone number. It's a confidential service for anyone with concerns or questions about any drugs or alcohol. To our audience, thank you very much for listening. If you want to get in touch with us, please email healthandwellbeing.communications@hse.ie. And if you think that this podcast would be relevant to any of your friends, family or colleagues, please share. Thank you for listening.